What I'm about to share may completely change the way you think about the blood pressure medication you take every day. If you're currently taking amlodipine, losartan, or lisinopril, there's a good chance that at least one symptom you've been blaming on aging, stress, poor sleep, or simply having an off day could actually be connected to your medication. And that's something many people never realize until much later. What worries me most is that people rarely run into trouble because these medications were prescribed incorrectly. More often, problems develop because patients were never fully told what to watch for. They weren't taught how these medications work inside the body, what side effects are common, which symptoms deserve attention, and which warning signs should never be ignored. Most appointments are short. Doctors do their best, but there's only so much information that can fit into a brief visit. As a result, many patients leave the office with a prescription bottle and only part of the knowledge they truly need. Today, I want to change that. By the end of this discussion, you'll understand some of the most important truths about these medications, including side effects that are common, side effects that can be serious, and symptoms that seem harmless but may deserve a closer look. More importantly, you'll understand why the ultimate goal isn't simply lowering your blood pressure. The real goal is finding a medication plan that keeps you healthy, safe, and comfortable for years to come. To understand why this conversation matters, let me tell you about Gloria. Gloria was 72 years old, organized, responsible, and incredibly committed to her health. She never missed a dose of medication. She attended every follow-up appointment. She carefully followed every instruction her doctor gave her. If there were such a thing as a perfect patient, Gloria came very close. After starting treatment, her blood pressure improved beautifully. Every reading looked encouraging. Every follow-up visit suggested the medication was doing exactly what it was supposed to do. Everything seemed perfect. But several months later, Gloria walked into the office with a concern she couldn't ignore. Her shoes suddenly felt tighter. Her ankles looked swollen by evening. Her legs felt heavy at the end of the day. She was beginning to worry. At first, she assumed she was gaining weight. Her daughter wondered if it could be a heart problem. The more the swelling continued, the more anxious everyone became. What nobody had fully explained to Gloria was that the very medication helping her blood pressure could also create a side effect that often looks like something completely different. And that brings us to one of the most important things every patient should understand. Amlodipine, losartan, and lisinopril may all lower blood pressure, but they are not interchangeable medications. They belong to different classes of drugs, and each one works through a different pathway inside the body. Amlodipine is known as a calcium channel blocker. Losartan belongs to a class called angiotensin receptor blockers, often shortened to ARBs. Lisinopril is part of a group called ACE inhibitors. Although all three medications aim to lower blood pressure, they achieve that goal in completely different ways. Because they work differently, they also produce different side effects, different benefits, and different warning signs. That distinction is more important than many people realize. When patients assume all blood pressure medications behave the same way, they often misinterpret what their bodies are trying to tell them. Someone who develops a cough while taking lisinopril may incorrectly believe every blood pressure medication will cause the same issue. Another person who experiences swelling while taking amlodipine may fear they are developing heart failure. A patient taking losartan may feel perfectly fine and assume there's nothing to monitor at all. But every medication leaves clues. Understanding those clues gives you a tremendous advantage. Instead of being surprised by symptoms, you begin recognizing patterns. Instead of reacting with fear, you respond with knowledge. And that understanding can help prevent unnecessary suffering and, in some cases, serious medical complications. Now let's return to Gloria's experience, because it highlights one of the most commonly misunderstood side effects associated with blood pressure treatment. Amlodipine is very effective at relaxing blood vessels and lowering blood pressure. However, one of its most common side effects is swelling in the ankles and lower legs. Many people don't know this. When swelling appears, they often blame salt intake, aging, inactivity, weight gain, poor circulation, kidney problems, or even heart disease. Those concerns are understandable because swelling can occur with all of those conditions. But amlodipine causes swelling through a different mechanism. The medication relaxes small arteries throughout the body. However, it doesn't relax the veins to the same degree. As a result, blood moves more easily into certain areas than it moves back out. Pressure gradually increases inside tiny blood vessels, allowing fluid to leak into nearby tissues. Over time, that fluid accumulates around the ankles and feet. Many patients notice a very specific pattern. They wake up in the morning feeling relatively normal. As the day progresses, swelling gradually increases. By evening, socks leave noticeable marks around the ankles. Shoes feel tighter, legs feel heavier. Arthur experienced exactly that situation. Arthur was 76 years old and had always considered himself relatively healthy. Every afternoon, he noticed that his ankles seemed larger than they had been earlier in the day. When he elevated his legs in the evening, the swelling improved somewhat. By morning, it often looked much better. Because of that pattern, he assumed it was simply another consequence of getting older. What Arthur never realized was that he had started amlodipine only 6 weeks before the swelling began. The side effect itself was manageable. The real problem was that Arthur never discussed it with anyone. He didn't want to bother his doctor. He assumed it wasn't important enough to mention. As the swelling became more noticeable, he grew increasingly frustrated. Eventually, he became self-conscious about how his legs looked when he went out in public. That frustration led him to make a dangerous decision. On days when he planned to leave the house, he occasionally skipped his medication because he thought it would reduce the swelling. Without realizing it, a manageable side effect was gradually becoming a blood pressure problem. And that's exactly how many patients get into trouble. The issue isn't always the medication itself. Often, the issue is a lack of understanding. When people don't recognize what a medication is doing, they start making decisions based on fear, frustration, or assumptions rather than accurate information. And unfortunately, that's only the beginning of what many patients never learn about these medications. One of the most common examples of this misunderstanding involves Lisinopril and a side effect that countless patients dismiss for weeks or even months before realizing what's actually causing it. The symptom is a dry, persistent cough. At first glance, it sounds harmless. After all, people cough for many reasons. Allergies can trigger it. Seasonal changes can trigger it. Acid reflux can trigger it. A lingering cold, dry indoor air, dust, or even mild irritation in the throat can all produce a similar symptom. That's exactly why so many people fail to connect the cough to their medication. What makes this side effect particularly tricky is that it doesn't always appear immediately after starting treatment. Some patients notice it within a few days. Others may not experience it for several weeks. In some cases, the cough develops months after the medication was started. Because of that delay, the connection often goes unnoticed. The cough itself usually has a very specific character. It tends to be dry rather than productive. There is no mucus, no chest congestion, no obvious sign of infection. Instead, it feels like a constant tickle in the throat that refuses to disappear. For many people, the symptom becomes especially frustrating at night. Sleep gets interrupted, energy levels decline, irritation builds. Yet because the cough develops gradually, many patients continue searching for other explanations. Helen was one of those patients. At 69 years old, she had been taking Lisinopril for several months when she noticed a strange tickling sensation in her throat. At first, she ignored it. Then the cough began. It wasn't severe, but it was persistent. Night after night, she found herself waking up because of coughing fits. Her sleep quality declined. She felt tired during the day. Eventually, she began assuming that aging was simply catching up with her. She purchased cough drops. She changed household products. She checked air filters. She wondered whether allergies had suddenly become worse. Nothing helped. When she finally discussed the issue during a follow-up appointment, one simple question changed everything. When did the cough start compared to when you started the medication? The moment she thought about it, the timeline became obvious. Nobody had ever explained that lisinopril-related coughing could appear long after treatment begins. Once she understood that possibility, the mystery was solved. Situations like Helen's happen every day. Many patients silently tolerate this side effect for months. Some become so frustrated that they eventually stop taking the medication entirely without informing their healthcare provider. That creates an entirely new problem because blood pressure starts rising again while the medical team remains unaware of what happened. But there is something even more important to understand about lisinopril, and it involves recognizing the difference between an annoying side effect and a medical emergency. A dry cough can be frustrating. It can affect sleep and quality of life, but is usually not dangerous. There is another symptom, however, that should never be ignored. Swelling of the lips, swelling of the tongue, swelling of the face, swelling of the throat. If any of these symptoms occur, particularly if swallowing becomes difficult or breathing feels restricted, immediate medical attention is necessary. This is not a situation where someone should wait until the next office appointment. It is not something that should be monitored at home for a few days. It requires urgent evaluation. In rare cases, ACE inhibitors such as lisinopril can trigger a condition known as angioedema. This causes rapid swelling beneath the skin and can become life-threatening if the airway becomes involved. Although similar reactions can rarely occur with medications like Losartan, the risk is most strongly associated with ACE inhibitors. That distinction matters. When people hear about coughing, they sometimes become unnecessarily frightened. But the symptom that truly demands immediate action is swelling involving the mouth, tongue, throat, or face. Knowing the difference can save precious time during an emergency. Now let's move to another issue that often surprises patients because it hides in places most people never think to look. Potassium. Most patients hear the word and immediately think about supplements. They assume that as long as they are not taking potassium tablets, they have nothing to worry about. Unfortunately, it isn't that simple. Potassium appears in many products people use every day. It can be found in salt substitutes. It can be found in electrolyte powders. It can be added to meal replacement products. It may be present in certain nutritional supplements and specialty seasonings marketed as heart-healthy alternatives. The problem is that both Losartan and Lisinopril can increase potassium levels in the body. For many people, this never becomes a serious issue, but when potassium levels rise too high, problems can develop. Potassium plays a critical role in controlling the electrical activity of the heart. When levels become elevated, heart rhythms can become abnormal. In some situations, those abnormalities can become dangerous. What makes high potassium particularly challenging is that symptoms are often subtle. A person may experience unusual fatigue, muscle weakness, muscle cramps, tingling sensations, skipped heartbeats, palpitations, or sometimes almost no symptoms at all. That was the situation Robert found himself in. Robert was 74 years old and genuinely committed to improving his health. After being diagnosed with high blood pressure, he carefully reduced his sodium intake. He read food labels. He followed dietary recommendations. He worked hard to make healthier choices. One of those choices involved switching to a salt substitute. From his perspective, it seemed like exactly the right thing to do. What Robert didn't realize was that many salt substitutes replace sodium with potassium. Without knowing it, he had created a situation where he was taking Losartan while simultaneously adding significant amounts of potassium to his diet every single day. For a while, nothing seemed wrong. Then subtle symptoms appeared. He felt weaker than usual. His energy dropped. Occasionally, he noticed strange sensations in his chest that felt like skipped heartbeats. Because the symptoms developed gradually, he didn't immediately recognize their significance. Eventually, routine blood work revealed the problem. His potassium level had risen high enough to require prompt medical attention. The most important lesson from Robert's story is that he wasn't careless. He wasn't ignoring medical advice. He wasn't doing something reckless. In fact, he was trying extremely hard to do everything correctly. The issue was simply that nobody had connected all the pieces for him. This happens far more often than people realize. Patients make decisions based on incomplete information. They follow one recommendation without realizing how it interacts with another aspect of their treatment. The result is confusion, frustration, and sometimes avoidable complications. That's why understanding how your medication works is so important. It's not enough to know the name of the pill. It's not enough to know the dosage. You also need to understand how that medication interacts with your body, your diet, your daily habits, and even seemingly harmless products purchased at the grocery store. Because sometimes the biggest risks don't come from dramatic symptoms. Sometimes they develop quietly, one small decision at a time, until routine testing reveals a problem that has been building beneath the surface for weeks or months. And that brings us to another issue that confuses many patients, the relationship between these medications and kidney function, a topic that often creates fear and misunderstanding the moment laboratory results start changing. And that brings us to one of the most misunderstood aspects of blood pressure treatment: kidney function. The moment many patients see a change in their kidney numbers, panic sets in. They log into their patient portal, notice that a lab value has shifted, and immediately assume the medication is damaging their kidneys. In some situations, that concern may be justified, but in many others, the reality is much more complicated. What most people don't realize is that Losartan and Lisinopril are not simply blood pressure medications. In the right patient, they can also provide long-term protection for both the kidneys and the heart. That protective effect is one of the reasons healthcare providers often choose these medications, especially for individuals who already have diabetes, kidney disease, or certain cardiovascular conditions. However, when these medications are first started, or when the dosage is increased, blood tests may sometimes show small changes in kidney-related measurements. A creatinine level may rise slightly, an eGFR value may decrease somewhat. For patients unfamiliar with how these medications work, those changes can be alarming. The natural reaction is to assume the medicine is causing harm, but that assumption is not always correct. These medications alter pressure dynamics within the kidney's filtering system. Because of that, minor changes in laboratory values can sometimes be expected as the body adapts. The important question isn't simply whether a number changed. The important question is how much it changed, how quickly it changed, and what the overall pattern looks like over time. That's why laboratory monitoring is so important. Without proper follow-up, patients are left trying to interpret complex medical information on their own, and that often leads to unnecessary fear. Sharon experienced exactly this situation. At 71 years old, she had high blood pressure along with early-stage kidney disease. Her doctor prescribed Lisinopril partly because of its potential to help protect kidney function over the long term. Several weeks later, routine blood work showed a slight change in her kidney numbers. Unfortunately, Sharon saw the results before anyone had a chance to explain them. The moment she noticed the change, panic took over. She convinced herself that the medication was damaging her kidneys. She considered stopping it immediately. In her mind, the evidence seemed obvious. The numbers had moved in the wrong direction. But when the situation was reviewed more carefully, a different picture emerged. The change was small. It fell within a range that could be monitored safely. Most importantly, it was being watched closely. What Sharon needed wasn't an immediate decision. She needed context. She needed someone to explain that one isolated lab result rarely tells the whole story. She needed someone to explain that trends matter more than single numbers. And she needed someone to remind her that stopping treatment without guidance can sometimes create more risk than continuing it. This is exactly why follow-up testing isn't just a formality. It's part of the treatment itself. These medications are powerful tools, but they work best when patients and healthcare providers monitor the body's response together. And that leads directly into another issue that becomes especially important for older adults: dehydration. Many people think of dehydration as a minor inconvenience. They imagine feeling thirsty, drinking some water, and moving on with their day. But when you're taking medications like Losartan or Lisinopril, dehydration can completely change how your body responds. Imagine that everything has been going smoothly. Your blood pressure is stable, your medication dose is appropriate, your laboratory tests look good. Then suddenly you get a stomach virus. Maybe you develop vomiting. Maybe you experience diarrhea. Perhaps your appetite disappears for several days. Or maybe you're outside during a heat wave, sweating far more than usual. Now the situation inside your body is completely different. The medication hasn't changed, but your hydration status has, and that matters. When fluid levels drop significantly, blood pressure can fall lower than expected. Kidney function can become stressed. Dizziness may develop. Weakness may appear. In some situations, serious complications can occur surprisingly quickly. This catches many people off guard because they assume the same medication routine should continue no matter what is happening. But illness changes the rules. Frank learned that lesson the hard way. At 78 years old, he developed a severe stomach virus. He struggled to keep food down. He wasn't drinking enough fluids. Yet every morning he continued taking his Losartan exactly as prescribed. From his perspective, he was being responsible. He had always been told not to skip medication, so he didn't. Later that evening, he stood up from his chair and felt the room begin to spin. His vision blurred. He became extremely lightheaded and nearly collapsed. The problem wasn't that Losartan had suddenly become dangerous. The problem was that Frank's body was operating under completely different conditions. His fluid reserves were depleted. His blood pressure had fallen too low. His kidneys were under stress. The medication that normally helped him was now acting in a body that was struggling to maintain balance. What Frank needed wasn't blind obedience to a prescription label. He needed a plan. He needed guidance on what to do during periods of illness. He needed to know when it was appropriate to contact his healthcare team and ask for instructions. Unfortunately, many patients never receive that conversation. They are told how to take their medication on a normal day, but are never taught what happens when circumstances change. And those circumstances can change quickly. A stomach bug, food poisoning, a heat wave, severe sweating, poor appetite. Even a few days of reduced fluid intake can significantly alter how the body responds to blood pressure medications. This is one of the most practical lessons every patient should understand. Medications do not operate in isolation. They operate inside a living body. And when that body's fluid balance changes dramatically, medication effects can change too. The goal is not to become afraid of treatment. The goal is to become aware. Awareness allows you to recognize situations that deserve attention before they become emergencies. Unfortunately, dehydration is not the only hidden danger many patients overlook. Another major risk is sitting quietly in medicine cabinets across the country, often purchased without a prescription and taken so casually that many people never think to mention it during a medical appointment. The surprising culprit? Common pain relievers. Millions of people use them every day for arthritis, back pain, sore muscles, headaches, and the ordinary aches that come with getting older. They seem harmless because they are available over the counter. But when combined with certain blood pressure medications, the story becomes far more complicated. And for some patients, that combination can create a serious threat to kidney health without them ever realizing it until routine testing uncovers the damage. That hidden interaction is one of the most important safety lessons every person taking Losartan or Lisinopril needs to understand. That hidden interaction is one of the most important safety lessons every person taking Losartan or Lisinopril needs to understand. When people think about medication side effects, they often imagine something dramatic. They picture a severe allergic reaction, a dangerous rash, or a sudden emergency that appears out of nowhere. But some of the most significant risks develop quietly through combinations of medications that seem perfectly ordinary on their own. One of the best examples involves common anti-inflammatory pain relievers such as ibuprofen and naproxen. These medications are found in homes everywhere. People use them for arthritis pain, sore joints, back discomfort, headaches, and countless everyday aches. Because they are available without a prescription, many patients don't think of them as medications that deserve special attention, but they do. For someone taking Losartan or Lisinopril, especially if they are also taking a diuretic, sometimes called a water pill, regular use of these pain relievers can place additional stress on the kidneys. Each medication affects the body differently. Alone, they may be appropriate and useful. However, when combined under the wrong circumstances, particularly when dehydration is involved, they can reduce blood flow to the kidneys and increase the risk of kidney injury. The danger is that nothing about the combination sounds alarming. A blood pressure medication, a pain reliever, perhaps a water pill, each one seems routine. Yet together, they can create problems that neither medication would necessarily cause on its own. Carol discovered this firsthand. At 73 years old, she was taking Lisinopril to manage her blood pressure. She also used a diuretic to help with swelling in her legs. For arthritis pain in her hands, she frequently took ibuprofen several times each week. To Carol, everything seemed under control. She was managing her conditions responsibly and following her routine. Then her laboratory tests began changing. Her kidney function worsened. Her blood pressure became more unpredictable. Suddenly, her healthcare team was trying to determine what had happened. The answer wasn't hidden in some rare disease or mysterious diagnosis. It was the interaction. Once her medication routine was reviewed carefully, the connection became clear. Adjustments were made, safer pain management strategies were discussed, and monitoring became more focused. Over time, her situation improved. The lesson from Carol's experience is incredibly important. Many people assume medication dangers come only from rare side effects listed in fine print. In reality, some of the greatest risks arise from common combinations that nobody thinks to question. That's why it's so important to tell healthcare providers about every medication you take, including products purchased at a pharmacy without a prescription. What seems minor to you may be highly relevant to your treatment plan. And speaking of symptoms that people often dismiss, let's talk about one of the most common warning signs that patients normalize until something serious happens. Dizziness. Nearly everyone has experienced it at some point. You stand up quickly, the room briefly feels unstable, your vision may dim for a moment, then everything returns to normal. Because these episodes are common, many people laugh them off. They assume it's nothing. But for older adults taking blood pressure medications, dizziness deserves respect. Amlodipine, Losartan, and Lisinopril all lower blood pressure. That's their purpose. When treatment begins or when the dosage is increased, the body sometimes needs time to adjust. During that adjustment period, dizziness can occur. This is especially common when moving from a lying position to standing. The problem isn't always the dizziness itself. The problem is what can happen because of it. A few seconds of instability may not sound serious, but those few seconds can lead to a fall. A fall can lead to a broken wrist, a fractured hip, a head injury, a hospital stay, and for many older adults, a single fall can dramatically change their quality of life. Joseph understood that reality all too well. At 80 years old, he valued his independence. He lived alone and took pride in caring for himself. He didn't like asking for help and preferred managing things on his own. A few days after his amlodipine dosage was increased, he woke during the night and walked to the bathroom. As he stood up, the room suddenly tilted. Everything felt unstable. He reached for the sink and managed to catch himself before falling. The incident lasted only seconds, but it frightened him. When we discussed the experience later, an important detail became clear. Nobody had thoroughly explained what he might feel after the dosage increase. Nobody had emphasized the importance of standing slowly. Nobody had suggested sitting on the edge of the bed for a few moments before walking. Nobody had discussed how dizziness might appear in everyday situations, especially in the middle of the night. He had been told the medication would lower his blood pressure. What he hadn't been told was what that process might actually feel like in real life. That difference matters. Prescribing a medication is one thing. Preparing a patient for the realities of using it is something else entirely. Now, mild dizziness doesn't automatically mean something is wrong. In many cases, the body adapts over time. But repeated dizziness should never be ignored. Near fainting should never be ignored. Actual fainting should never be ignored. Those symptoms deserve discussion because they may indicate that adjustments are needed. And that brings us to another mistake that causes enormous confusion among patients trying to manage their blood pressure. Many people become obsessed with individual blood pressure readings. They see one high number and immediately conclude their medication isn't working. Or they see one low number and become convinced the medication is too strong. The problem is that blood pressure doesn't work that way. Blood pressure changes constantly. It responds to sleep. It responds to stress. It responds to pain. It responds to physical activity. It responds to caffeine. It responds to meals. It even responds to anxiety about checking the reading itself. A single measurement is just a snapshot. It captures one moment in time. What matters most is the overall pattern. What matters is consistency over days and weeks. What matters is the trend. Diane learned this lesson after months of unnecessary worry. At 67 years old, she checked her blood pressure whenever she felt anxious. If she had a headache, she checked it. If she felt stressed, she checked it. If she watched upsetting news, she checked it. When her reading appeared high, she checked it again, and again, and again. Before long, she had pages filled with numbers and no idea which ones actually mattered. The more she measured, the more frightened she became. She convinced herself that her medication had failed. But when a structured monitoring plan was introduced, everything changed. She began checking her blood pressure at consistent times. She rested quietly before taking measurements. She stopped repeatedly rechecking every unusual reading, and a much clearer picture emerged. Her medication was working far better than she had believed. The problem wasn't the treatment. The problem was the method she was using to evaluate it. This happens far more often than people realize. Fear creates noise. Noise creates confusion. And confusion often leads patients to make impulsive decisions about their medication. Some start skipping doses. Some take extra doses. Some demand changes based on isolated readings that don't reflect the bigger picture. Good medication combined with poor interpretation can produce poor outcomes. That's why understanding patterns is so important. Because blood pressure management is not about reacting emotionally to every number that appears on a screen. It's about recognizing trends, staying consistent, and making decisions based on reliable information rather than momentary fluctuations. And that leads directly into another issue that causes countless unnecessary problems for patients taking these medications. The question of timing, missed doses, and what people do when they suddenly realize they forgot to take their medication.